tragedy struck. And we are horrified at what happened.
We better get out of the way!
It marks our memories. We know where we were on 9/11.
Mayor Denise Parker reflected on the 9/11 tragedy as she spoke to City of Houston employees. She chose the National Day of Service and Remembrance to train city workers to perform CPR so they can train other Houstonians.
Every day, thousands of people start off on an ordinary day and don't make it home because they have a heart attack that either cannot be addressed or no one around them knows how to address the situation.
The mayor shared a story of her own loss. Her father, an EMT himself, died of a heart attack at a young age with no one near him to render CPR.
My own dad, at the age of 51, younger than I am now, died of a heart attack. He was a marathon runner. He was very fit. The evening before he died, he had been refereeing an intra-squad Marine basketball game. He loved to umpire and referee, he liked telling people what to do. He'd been having heart pains, I knew that, but he didn't seek treatment. And he started apparently feeling tired, didn't feel well, left the gymnasium full of men and women who knew CPR and could have helped him, went and sat in his car and died, and they didn't find him till the next day.
CPR, or cardiopulmonary resuscitation, is a valuable key to saving lives. 142 city employees were invited to these sessions to learn what the American Heart Association calls hands-only CPR.
Heart disease is still the #1 killer of both genders, everybody in this country, and it's critical that we make a dent in that. And the only way to do it is to involve bystanders. If you don't start quickly, they have no chance. You've got to get in there and get started. So it's a simple thing. It doesn't take a lot of time. It doesn't take a lot of strength. And we're trying to make sure that this 4th largest city in the nation, which has the biggest and best medical center on the planet, also has some very involved, caring citizens who know how to help.
Those who took the class today received a CPR kit containing an inflatable victim to practice with. They each made a commitment to train 5 to 7 other people, including co-workers, family members, and friends.
Make sure that you look at someone and say, "You, call 911.
Unfortunately, we know people are going to have heart attacks where their hearts are going to stop out in the community. It happens every single day. We also know that if someone does bystander CPR, which is actually easy to do, it more than doubles that patient's chances of survival and survival back to their previous lifestyle. It more than doubles that chance. And to do CPR really is very easy.
Donna Travis with the Department of Health and Human Services thinks this training is a great idea.
Today we were training city employees from the Department of Neighborhoods on bystander CPR, which is hands-only CPR. We're really focusing on increasing the capacity of Houstonians to provide hands-only CPR. What we see in certain areas in the city of Houston is that out-of-hospital cardiac arrest is very high, but in some of those same communities, the initiation of CPR is low, which means the likelihood of those persons surviving after out-of-hospital cardiac arrest is very slim. So we want Houstonians to know how to perform bystander CPR and to do it when the situation arises.
Renee Ramon, Community CPR Manager for the American Heart Association, agrees.
Well, this year, 400,000 Americans will suffer cardiac arrest outside of the hospital. Of those, much less than 12% will survive. So it's a huge crisis facing our country, especially with obesity rising and risk factors for heart disease increasing. 88% of all cardiac arrests that happen outside of the hospital are going to happen at home. So like I said earlier, it's critically important that everyone learns CPR. It's very easy to learn, and the American Heart Association believes everyone should learn. It's very simple. Something as simple as calling 911 and pushing hard and fast in the center of the chest to the beat of staying alive. That's all you need to know. And we want people to feel empowered and not to be afraid to act.
Mayor Parker got into the spirit and practiced her CPR skills.
Great. She did great. Mayor Parker can do it, and like she does everything else, it was, no nonsense. She got in there and did it. There's nothing sissy about our mayor.
So she's known CPR since she was a young lady, and this is not the first time that I've been with the mayor where she has demonstrated her CPR skills, and she's very passionate about it, and she really is coming from her heart when she advocates and encourages people to learn CPR.
The mayor did excellent. She actually shared with us a personal story, which was quite touching, but I think it kind of reiterated to everyone the importance of initiating CPR when the situation arises.
Mayor Parker inspired city workers to get involved and learn how they can save lives.
We're here today to take a gift, and that gift is to be able to help our fellow human beings. And I appreciate you being here today, and I hope that you take the lessons from today and spread them far and wide. Thank you.